Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. Today we will study about Symblepharon. Symblepharon can be asked for your 3 mark question as well as a short note. More than that, it is important to know about the Symblepharon clinically also. Without much delay, let's begin our video on Symblepharon. So as you can see in this picture, there is some adhesions which are formed between this eyelid as well as the eyeball. So from the conjunctiva of the eyelid, that is palpable conjunctiva, to the bulbar conjunctiva, there are few fibrous adhesions which are formed. This is called as Symblepharon. Okay. So you can define this Symblepharon as a partial or complete adhesion between the palpebral and the bulbar conjunctiva. So there is adhesions formed between the eyelids and the eyeball. Okay. So this Symblepharon is actually a sign. It is not a disease per se. So you should always look for the disease which is causing this sign of Symblepharon and try to treat this Symblepharon as well as the disease. So this is one more picture which is showing the adhesions here. As you can see, from the palpebral conjunctiva to the bulbar conjunctiva, the fibrous bands are extending. That is Symblepharon. So what are the causes for this Symblepharon? So anything which leaves raw surface on both the palpebral and the bulbar conjunctiva simultaneously will lead to the Symblepharon formation. Like in case of chemical injuries where there is raw surface between palpebral and the bulbar conjunctiva following penetrating traumas or even the trachoma, and the conjunctival inflammatory diseases like Stevens-Johnson syndrome and even the ocular pemphigoid. So all these diseases can lead to Symblepharon formation. So how these patients of Symblepharon will present with? The symptoms are like, obviously they will not be able to move the eyelids because there is a firm adhesion. Since there is no movement of the eyeball because of the adhesions, the patients can experience double vision in that particular gaze. Since the eyelids are not covering the ocular surface efficiently, the eye will end up being dry. So the patient will experience symptoms of dry eyes, and even it can be a cosmetic disfigurement. And the Symblepharon is classified into different types. Maybe this classification is important in the management aspect of the Symblepharon. Okay, so the first one is the anterior Symblepharon, where there is adhesion between the eyelid and the eyeball only in the anterior part of the eyelid. Whereas in the posterior Symblepharon, the adhesions are formed in the posterior aspect of the eyelid. Okay, whereas in total Symblepharon, the whole of the eyelid is attached to the conjunctiva. So this is one classification which is mentioned in the textbooks, which may be helpful in that management aspect. Okay. So what are the complications of this Symblepharon? As I told, the cornea and the conjunctiva will end up dry because of inability of the lids to close the ocular surface efficiently. So there is dryness of the conjunctiva, and the chronic dryness will eventually lead into keratinization of the conjunctiva. So whenever you find a patient who has this history of chemical injury or the trauma or trachoma, the prevention of this Symblepharon formation is more important. This plays a very important role compared to your treatment. Okay. So in prevention, what you can do is you can use a glass rod. Okay. So this is the glass rod which we use. So this glass rod is smeared with a lubricating eye ointment, and the swiping of the conjunctiva is done like this at least 2 to 3 times a day, so that there is no formation of adhesion. At the same time, the palpebral and the bulbar conjunctiva are healing efficiently. Okay. So the swiping with a glass rod with a lubricating eye ointment is the important preventive aspect in the chemical injury cases. The second preventive measure is you can use a large sized therapeutic contact lens. So as you can see here, there is a large sized contact lens which is placed over the ocular surface. So the raw areas of the palpebral and the bulbar conjunctiva are not meeting at all. So there is good healing of both the conjunctiva without formation of any fibrosis or the adhesions. So what to do once there is already Symblepharon which is formed? So now you have to cut this Symblepharon which has formed. That is called as symblepharectomy. Symblepharectomy is the treatment name which is given for Symblepharon. So once you cut that, again you are leaving the raw surface. So that raw surface is covered either by using the conjunctival graft from other eye or the other side of the same eye, or you can also use the amniotic membrane graft to cover the raw area and let it heal. So that is the treatment aspect of Symblepharon. So hope this short video on Symblepharon is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos and leave your valuable comments. Thank you so much.